This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
So I want to talk about hepatic encephalopathy, which is something we see a fair amount due to our high levels of cirrhosis and chronic alcohol use. Does anyone know how we diagnose hepatic encephalopathy? So it's usually in someone who's confused. And one of the common labs that we do get and like to see if it's elevated is ammonia. So it's actually kind of tricky in that ammonia being elevated is really not necessary for diagnosing hepatic encephalopathy. It's been shown that ammonia doesn't trend very well, one, with whether they have it or not, and it doesn't trend well as it's going down with symptom resolution. So when an ammonia level is high, it does help. Really, the main ways to diagnose hepatic encephalopathy is if you have someone who's confused, appears encephalopathic, and they have known cirrhosis, and you have less suspicion for other causes, such as seizures or infection, brain bleeds, or if you've ruled those things out, then you're kind of left with hepatic encephalopathy being more likely. You'll see, the main treatment of it is with lactulose, which does help just remove ammonia from the body. But even inpatient guidelines don't actually even have you trending or doing multiple ammonia levels, because trending the ammonia level doesn't actually help at all with being able to tell that they're having resolution of their encephalopathy. The only way that you trend or increase or decrease your lactulose levels is just about, are they getting better? Are they clinically getting better? Are they getting less confused? There's a study in 2020, American Journal of Gastroenterology, where there was, of the 550 patients who were diagnosed with hepatic encephalopathy, inpatient, treated with the usual treatments, only 60% of them even had an elevated ammonia level at all. So almost half of the patients, their level was completely normal and still were diagnosed and treated as HE and got better with the usual treatments. So it's just one thing to make sure that if we ever get pushback from the internal medicine team and say, hey, well, did you get an ammonia level or was it normal? That if we have a high clinical suspicion for hepatic encephalopathy, that's really all that you need. And then does anyone know why lactulose is helpful in hepatic encephalopathy? Does anyone know what it actually does? Because we give it orally, sometimes in people who are really confused, we have to give it rectally. And so it's, certainly not an easy medication to administer, but does anyone know what it does? So its main job is it actually doesn't get absorbed by our body at all. It just stays in the GI tract, and it acidifies the GI tract. And ammonia is a neutral, a charged neutral NH3. And when you acidify the GI tract, it turns ammonia into ammonium, which is NH4, which is positively charged. And so the positively charged ammonium just doesn't absorb into your GI tract very well. So by acidifying the GI tract, you just decrease your body's ability to absorb ammonia. And because it's also a laxative and it flushes out that ammonia even faster, the way that you decrease the ammonia levels is just because you're acidifying the gut. So that's how it does its job. And certainly we usually admit these patients, and then after a couple of days, their confusion gets better, and then they get to go home.
Hey, Denver listeners. The Emergency Medical Minute invites you to our toxicology fundraiser, also known as Talks 2025, on Thursday, September 11th. It'll be an evening of toxicology education, catered food, and community, with all ticket sales going to charity. Join us from 6 to 8 p.m. at the 11th Avenue Hostel. Get your tickets now through the link in the podcast description.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.